Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Thursday, May 7th, and this is my daily briefing. We've had no new cases, so we're still at a total of 41 cases to date in Missoula County. 39 of those cases were identified by testing, and 2 were epi-linked. We've had 40 recoveries and 1 death, and we have no cases in isolation currently and no remaining close contacts. The state has had a total of 456 cases and has had 16 deaths. So first I want to talk about testing. Part of a responsible reopening strategy is ensuring that people with symptoms of COVID-19 have the ability to get tested. As things open up and people interact more, identifying cases and getting them isolated is going to be incredibly important. Remember that people with COVID-19 can have really mild symptoms and still be able to spread the disease early on. So it's up to all of us to watch out for these symptoms and to get tested. As we've covered, the CDC expanded the symptoms list last week. So if you've had a fever, cough, shortness of breath, chills, muscle pain, new loss of taste or smell, sore throat, vomiting, or diarrhea, please contact a testing center to get a test. Our website, missoula.co/cvirus, has an entire page dedicated to testing and screening centers. You can contact any of these providers. Do note that each may have a different associated cost or different insurance that they may accept or not accept. The county's testing center offers testing by appointment, and you don't need a doctor's referral or a prescription to get tested there. Testing is free, but our hours are limited to weekdays, and our service is limited to Missoula County residents and people, healthcare workers and first responders who work in Missoula. You can reach our testing center at 406-258-INFO. That's 406-258-4636, and select option number 2 to get an appointment. Next, I want to talk about reassessing. So we've gotten some feedback from community members that they're nervous about reopening. They're just concerned that we'll have a spike in cases that we may not be able to get in front of. We recognize that there will likely be additional cases of COVID-19, and we also acknowledge that there's a possibility of another wave of this virus. So here's what I can tell you right now. We took a much more gradual approach to reopening Missoula. When the governor announced his reopening plans, we still had multiple active cases, and we had lots of close contacts that were still in quarantine, and we were still getting new cases. So reopening quickly and without guidance was a wrong move at that time. We're now at zeros across the board. Does that mean that the risk is gone? No, it doesn't. As you've heard me say just a few moments ago, there can be mild cases that can spread the disease. However, that doesn't mean that putting our toes in the water is a bad thing. So with the increase in testing and keeping people aware of social distancing and other preventative measures, we can hopefully minimize the number of new cases and future spread. That said, we will be monitoring a lot of things here at the health department. We're going to be looking at cases, testing capacity, how the virus is spreading, our healthcare resources, and our ability to do contact tracing. If things change, we will know, and we'll be able to provide additional guidance or put protections into place. We do hope that we don't have to backpedal, which is why we took the approach that we did. However, a big part of this equation is all of you. Last week, our epidemiology team at the University of Montana showed through modeling that behavior really matters. A slight change in people's adherence to social distancing could mean a difference in the number of new cases that we see. And those actions really, the actions of all of us are really what's going to make a difference. If the public health side of this isn't convincing, I'll make the economic argument. Cases really need to stay low for people to feel safe going out and doing things, which is what is necessary to give the economy the opportunity that it needs to recover. Either way that you go, social distancing really matters. In summary, yes, we will watch the numbers as well as many other things here in Missoula County. This will be a continuous reassessment. However, you and your behavior are huge parts of the mission success. So next I want to talk about graduation. We've had people asking us about graduation. We recognize the importance of graduation. We want this event to happen in the best way that it can. Our department is reviewing the guidance from the state and the CDC, and we're working with local school principals and superintendents, and we will share updates with you here when we have updates to give. So that's all I have for my daily briefing for today. As always, you can subscribe to me on YouTube, click the notification bell so that you get notified when new videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department. We post lots of great information there. You can call 258-INFO if you have questions about COVID-19 or need to know what resources are available to you or if you just need to get a test scheduled through our testing center, you can call that number. And you can check out our information on our webpage at missoula.co/cvirus. So until tomorrow, everybody, stay healthy.